The regional administrator, Mbanangosi Prince Gija, the regional secretary, Mr. Mpanza, His Worship, the Mayor of Matsapa, Councillor Russo, Honorable Minister of Health, Senator Liz Nkosi, Your Excellency, the U.S. Ambassador, Ambassador El Miller, the Permanent Secretary of the Ministry of Health, Dr. Zwane, SNAP Program Manager, Magasi Ndimatse, the PEPFAR Country Coordinator, Ms. Kunene, former Secretary to Cabinet, Special Advisor to Georgetown University, Babembuso Lamini, CDC and USAID Country Leadership, GU Regional Field Director, Professor Ojo, GU Country Resident Director, Professor Samson Aumba, PSI Country Representative, Dr. Endale, URC Country Director, Dr. Ioannis Gabriesas, ICAP Country Director, Dr. Ruben Sahabo, ECPAF Country Director, Dr. Caspian Choraya, MSF Medical Director, Dr. Birame, GU, SLT, and GU staff here present, other implementing partners and bilateral organizations present, members of the media, Chakaza Emphilweni clinic staff, ladies and gentlemen, good afternoon. It is my singular honor as your program director today to welcome all of you to this special occasion where we are having the official commissioning of Chakaza Emphilweni Clinic, which was formerly called, it was 2 clinics by then. It was under PSI at that time as New Start Clinic and Litsemba Letu Men's Clinic, and also for the official launch of the automated medication dispensing system called Lula Meds. I will not take much of your time. I am just here as a mouthpiece to usher in people who are of importance to actually speak on this special occasion. And I will humbly ask Her Worship, Councillor Russo, the Mayor of Matsapa, to come and welcome us to Matsapa and officially start the proceedings. Councillor.
Good afternoon, everybody. I'm sure you can hear me. Yeah. It gives me great pleasure as the mayor of this wonderful town to be present here in this important ceremony of the official commissioning of Chakaza Emphilweni Clinic. But before I proceed, I would like to acknowledge the presence of the Honorable Senator, the Minister of Health, Senator Liz Nkosi, the Ambassador of the United States of America, His Excellency Earl Miller, the Manzini Regional Administrator, Chief Kicha, the Principal Secretary in the Ministry of Health, Dr. Zwane, my CEO, senior government officials, all these doctors available here. There's too many of them to mention. The country director of Georgetown Global Health, Dr. Samson Aumba. The employees of Georgetown Global Health and Chakaza Emphilweni Clinic. Members of the media, distinguished guests, ladies and gentlemen, all protocol observed. I greet you. The town of Matsapa is known as the kingdom's investment hub, and thousands of people visit the town daily, either for business, work, recreational purposes, and their need for accessible healthcare services is in demand. We believe that the addition of Chakaza Emphilweni Clinic will greatly assist the town of Matsapa to meet the healthcare demands of this town with the population. As As Council, we are extremely grateful for the immense consideration of the needs of the population of the town and surrounding areas in relation to the operating hours of the clinic. Most people in the town work in a fast-paced environment, and the extension of the operating hours of the clinic will see more people having the opportunity to access the medical services, which we thank you very much for. We would like to commend the collaboration of the Ministry of Health in Eswatini and Georgetown University in implementing this important project that will yield positive results regarding the availability of healthcare services in Matsapa and the country at large. The town of Matsapa has, for years, battled with a high rate of HIV/AIDS prevalence. However, with the dedication of the Ministry of Health, supported by its implementing partners such as PEPFAR, we have seen a drastic decline in the HIV/AIDS prevalence in the town and the surrounding areas. This level of commitment by PEPFAR and the Ministry of Health in ensuring that Matsapa is a lively and healthy town is really commendable. As I conclude, ladies and gentlemen, I would like to pledge that Matsapa Town Council is committed to working closely with Chakaza Emphilweni Clinic to ensure that the clinic has the conducive environment in which it operates and also offers assistance in any possible way. We thank you very much for this wonderful project. Thank you.
Another round of applause, and thank you very much to fellowship. Another round of applause. At this juncture, I think it would be prudent that we actually get an overview of some of the services that have been offered by this clinic. We are having this official commissioning today, but the clinic has been operational for the past 2.5 years, since October of 2020. So we'll get an overview of what kind of services are being provided and some of the tangible results and outputs that are coming from the work that the staff at this clinic have been tirelessly putting in. So I'll welcome Dr. Peter Bongomin, the Chief Technical Officer and Deputy Resident, Country Resident Director for Georgetown University, to come and give us that overview. Can we receive him with a round of applause? Thank you.
Honorable Minister, the Regional Administrator, Ambassador Miller, I can't go through the full protocol. Ladies and gentlemen, I want to recognize your presence here. My job is very simple this afternoon. My name is Peter Bongomin. I'm the Chief Technical Officer at Georgetown. I want to quickly give you a sense of what we are doing at Chakaza Clinic. So I'll run you through a very quick profile of the facility, the staff complement, who is doing the actual work in the clinic, and what kind of services are being offered to our clients, and a snapshot of some performance indicators, just to give you a sense of what we're trying to do. I will also speak a little bit about the automated medicine dispensing system. In terms of location, I don't need to explain, since we are all here. The clinic is strategically located in the middle of Matsapa town, the industrial hub of Eswatini. We are serving a population of around 40,000 people during daytime. But also because we offer after-hour services at night, we have access to about 8,000 individuals who can come and get medication refills, for example. But also we run services up to 8 o'clock. So about 8,000 individuals can be served at night. I think as the program director mentioned, this clinic transitioned to Georgetown with effect from October last year, October 2022. with support from CDC through PEPFAR and implemented by Georgetown University. We have two wings. One side is male-friendly, the other side is female-friendly, but it really operates as one clinic. From Monday to Friday, we are open from 8 o'clock to 8 p.m., and then on Saturday, we are open from 8 to 1 p.m. However, if a client makes a call and they need help, we're actually available to provide support at any time. We have about 2,500 clients who we are carrying active on ART, antiretroviral treatment right now, on HIV treatment. We don't have, these are not the only services we're providing. We're also providing prevention services. But as you'll understand, that's a little bit more difficult to measure. But otherwise, we're carrying around 2,500 clients who are active on antiretroviral therapy by the end of March 2023. You'll also see, when we do a quick tour of the clinic, that we have installed an automated medication dispensing system. It's a 76-door pigeonhole locker system with capacity to serve almost 200 clients a day. It's a small clinic. We have a total of about 13 staff in the clinic, 1 lead doctor, 4 nurses, 2 administration assistants, and so doubles as our laboratory staff. We have 2 expert clients, 1 hygienist, 1 HTS counselor, supported by the phlebotomist, and then 1 data clerk. That's a total of 13 staff who man the clinic. About what services are provided in the clinic? Obviously, because we are TB HIV implementing partner, we have TB HIV screening and testing services, and we double that with treatment. So we're also able to treat all of the individuals who test HIV positive and provide refills for those who are on treatment. Same thing for TB. Prevention services are a big area of focus for us. For males between the ages of 15 and 29, we offer them VMMC. Doesn't mean if you're 40 years old and you require VMMC, we will not give it to you, but the pivot is really 15 to 29. We also provide pre-exposure prophylaxis. In short, we call that PrEP. You've seen billboards all around town, interesting people to come and access PrEP. We provide PrEP to prevent HIV acquisition for individuals at excess risk. But also we provide what we call post-exposure prophylaxis. For example, if there's a young woman who has suffered sexual violence, within 72 hours, if you present to the clinic, we can give you medications that can ensure you don't get infected with HIV if the person who violated you was HIV positive. We also provide TB preventive therapy, and we're also providing COVID-19 vaccinations integrated into the services that we are doing, as well as antenatal care for pregnant women. But more importantly, especially for this environment, we have integrated non-communicable disease screening and treatment. So for our patients who have got HIV, and even those who come without HIV, we screen for diabetes, we screen for hypertension, and if you screen positive, we provide you with treatment. But I think this is an area that we will need to discuss and explore how we can strengthen treatment for those individuals. We also have cervical cancer screening and treatment for women who are living with HIV. Every year we screen every woman who is living with HIV for cervical cancer. Actually, it's not for cervical cancer. We screen you for precancerous lesions. And if you have precancerous lesions, we are able to offer you treatment within the clinic. For those who have got overt cancer, we refer them to tertiary institutions for treatment. We also screen for sexually transmitted infections. I've already mentioned COVID-19. Sexual health, very, very important. We're providing sexual health counseling for males especially. And we've realized that this is actually a very big area of need and has actually helped to increase demand among the male population in this community. We are planning to integrate HPV vaccination. We haven't started yet. Following the school campaigns that were recently conducted in the country, we're working with the API program to get HPV vaccination integrated in the clinic, as well as, of course, counseling, health education for general health education and counseling. It's important I speak a little bit about how do we make sure that the people we are looking after stay on treatment and do not miss their appointments. So if you look at this slide, for the last 3 months, we had 3,200 individuals that had appointments to come and pick up medications from our clinic. 2,700 came, that's about 86%, so 14% missed appointments. What did we do for this 14%? Usually what we do, we call you up if you didn't come. What happened? How can we help? And we were able to call almost 100% of all the individuals that missed treatment. We reached 80% of these individuals. There are reasons why you cannot reach everybody. And for the people that we called up, we were able to reappoint 287, and 110 individuals got their medications. So let me just speak a little bit about this. So we have an appointment system for anyone who is coming to pick up their medications. 3 days before you come, we call you. Oh, Pido, your clinic appointment is coming up. Just to let you know, we are waiting for you and we're ready and happy to receive you when you come. Now, on the day of the clinical appointment, if the individual doesn't show up, we get a list, short list, and the following day, we call them up. Again, after 3 days, we call you up. Before you become a defaulter, we actually arrange for a home visit if required. So, this is a very manual system. We have been using our expert clients and our nurses to do that. But I'm happy to say that we're trying to automate this system. There's a module within CMIS that actually can allow sending of automatic reminders to our clients. It doesn't always work, but I think as we go along, these bugs will be fixed. So what happens? If a client shows up, we verify. If you have come today for your clinical appointment, we verify if the phone number you've given to us can actually receive a reminder. So usually within CMIS, with a client sitting in front of us, there's a code that is entered into CMIS. And within 180 seconds, the client will receive a verification. Therefore, the provider will know that this number actually works. Now, automatically, for your next appointment, you'll receive a reminder 3 days before the appointment. And then, if you don't come to the facility, you'll also receive a post-reminder system, not a post-reminder SMS 3 days after that clinical day. So this is the automation where we're going. Like I said, there's still glitches with it, but this will really help us quite a bit, not just in this clinic, but in the whole country, to ensure that reminder systems are automated and we are able to keep our clients on treatment. This has stopped working, Simanga, and I don't know where the computer. You'll need to move it for me manually. I have only 3 more slides and I'll sit down. So the appointment system that I've told you works for all clinical appointments, whether you're coming for VMMC, you're coming for PrEP, you're coming for ART refills or TB refills. It's an appointment system and a reminder system for all services. Next slide, please. Okay, in terms of key performance indicators for the last 6 months, we have a system where we track performance to targets every quarter, but this data is aggregated data for 6 months. At the end of 6 months, performance to target should be about 50%. And where you see green, it means all is good. So testing indicators, testing indicators, we're doing great. Yeah. We have some challenges where you see red. So we could, and I'm happy that the mayor is here, we actually have capacity to look after many more pregnant women, but we're not receiving many of those. That's why you see that performance to target is very low. So let's spread the word out to this community. This clinic is super available. Pregnant women, you don't only need to, if you went to RFM, that's great. But also, if this clinic is closer to you, please come and see us. We're able to give you the services. For PrEP, prevention of HIV using treatment, tenofovir and lamivudine, PrEP, that's what we're using in this country. We're way above the 6-month target, 230. At the end of the year, we should be at 100%. And by 6 months, we should have been at 50%. TB, we were only at 20%. Remember, when this clinic transitioned to us, in the first quarter, we were setting up systems. So most of these performance indicators were second quarter performance indicators. But again, this is an area where we could do more. And Honorable Minister, I would really strongly lobby that we should have capacity to test for TB in this clinic, especially looking at this community. So right now we're able to take sputum, for example, but we need to ship that sputum somewhere else. So I think if we could have expert for this clinic, I'm just lobbying really. I think we'll really go a long way to try to solve that problem and increase access for our clients. Yeah, if you're testing very few people, you're probably not going to catch a lot of people for TB treatment. That's why you can see we were at 9%. But pretty much all of the other indicators are in a good place. Voluntary medical male circumcision. Again, I want to just share for especially the leaders in this community. We have capacity. We have 3 beds in our theater, fully functional. And Honorable Minister, we have shifted, we have transitioned from a doctor-led VMMC to a nurse-led VMMC, and it's fully functional. We can circumcise 20, 30, 40 males daily. So again, for the community here, please, any young men that are at home, they're not circumcised, please send them. We want to circumcise them in an effort to prevent HIV. Please. Okay. Then I'm hoping that you'll see our automated medicine dispensing system. Most of us have seen what this system looks like. It's a system that has got several lockers in there. The client gets a one-time PIN. When you receive that PIN, you come and punch it in. There's a computer screen and keyboard. And your locker opens up, and pre-packed medication, you can actually access them. This is really excellent because, Honorable Minister, in terms of human resources for the future and moving forward, you will need fewer people to make available the same number of refills we are doing now with minimal staff. So I think this is something that, if scaled up countrywide, would actually help to reduce some of the challenges we are having with human resources. But beyond that, for the client receiving treatment, convenience. I don't need to come and find the clinic open before I can receive my medication. Maybe I work from 5 o'clock to 5 o'clock, and I'm coming to the facility is closed. You can come pick your medication anytime, as long as you're within that period that we had agreed on, about a week. Come at night, public holiday is a Sunday, no problem. You can come, put in your PIN, get your medication. So we want to improve client convenience, improve client experience, so that we can keep our clients on treatment as part of our chronic care model. Last slide. So this is what it looks like. We call it Lula Meds. Lula is a Siswati word that means easy. We don't recruit everybody on this system. If you're unstable, you are new on ART, you're not virally suppressed, you're not eligible for this system. We look for people who are stable, established on ART, should have been on ART 12 months or longer, they have 2 suppressed viral loads, you're a perfect candidate for this system. But in addition to this, we can use this for PrEP. We can use this for family planning commodities. You can use this for a variety of things. So we're really happy to have pioneered the system, and I'm hoping that in the next so many months, we're able to have so many facilities benefit from this. So you're welcome to see how it works in this facility a little bit later on. I thank you for your attention. Unless, no, you can move forward. I think that's what I prepared for you. Thank you very much for your attention.
Thank you very much, Dr. Fido.
Oh, yes.
Pinning stuff on us. I'm not sure what they are. I'm very, very much afraid of the age of AI, but I think we're already seeing some of the benefits of integrating artificial intelligence into the work that we're doing. This is, Honorable Minister, in line with the e-health strategy of the country and the overall e-governance strategy of His Majesty's government. I will not take too much of your time. I think every esteemed member of this august house today really wants to see the clinic that has been showered with accolades this afternoon and maybe have an experience of the automated dispensing systems that we're using. I think our ushers will help us as our guests move. We're going to move to the clinic for a tour of the clinic, which will be led by the lead for the clinic, Dr. Rufaro Mapaona. Then we'll also go to see the demonstration of the Lula meds, and then we'll come back again for some other deliberations. Otherwise, thank you very much. RA, Honorable Minister, Your Excellency, and Your Worship, ladies and gentlemen, I hope that was a very eye-opening tour in relation to what we're trying to commission today. I think there is more that could be shared, but time is not always on our side. Some of the most exciting things are the ones that require more time, and they usually happen when we have the least time available. We're just going to go into a segment where we will have a few of our senior colleagues sharing some remarks about today's occasion. The work that you are seeing today is supported through the generous heart of the American citizens, money channeled through PEPFAR, and GU is just a mechanism for continuing the work that has been done by previous partners. To recognize the work that was handed over to GU, I will invite Dr. Ndale, the country representative of PSI, to give his remarks. Please, with a round of applause.
Honorable Minister of Health, Senator Lizin Kosi, Your Excellency U.S. Ambassador Earl Miller, Minister of Health higher officials, PEPFAR acting coordinator, CDC team, country directors of implementing partners, and GU leadership, and the co-director, Professor Sylvia. Good afternoon, all. It's a pleasure to be part of this important event that we are launching. Chakaza, I'm learning Siswati as well. Chakaza clinic transitioned from the previous Litsemba, Letfu, and New Start clinics. The new automated drug dispensing lockers that we just observed, Lula meds, are a testimony of our evolving and patient-centered innovations that are continuously designed to make chronic care easier for our patients. Our presence here today is also a testimony of the Ministry of Health's commitment on innovations and sustainability of the gain maintained to date through the health sector. We are also here to testify our strong partnership with our Ministry of Health and PEPFAR through CDC that advanced PSI's Center of Excellence that you have observed to have the foundation and GU and CDC taking the legacy to the next level. We are appreciating. The Litsemba Letfu Clinic, just to give you some background, was focused on male wellness. We went through multiple project transitions. Initially, this clinic was opened back in 2009, supported by Bill and Melinda Gates Foundation, and then it transitioned to USAID CPP program for about 3 to 4 years until it was transitioned to PEPFAR through CDC, which is really a great milestone under the SCORE project that PSI was leading. And Litsemba Letfu Clinic that you observed on the main side was successfully and safely circumcising about 7,000 men through our journey. Leveraging PSI's regional success, we established a co-located New Start clinic leveraging our experience in southern region with the brand New Start. And New Start was able to provide HIV and comprehensive sexual reproductive health services, including cervical cancer screening and treatment of precancerous lesions. The clinic that was led by New Start Clinic actually screened more than 1,000 women living with HIV at the clinic. PSI worked closely with CDC and GU to facilitate a smooth and seamless transition of 2,300 clients on ART, where at the time of transition, we had 95% of the clients on multi-month dispensing. That was also a big success. Transitioning these clinics and the clients required a well-thought, thorough, and responsible transition that actually puts the clients at the center of the transition. We are grateful of the continued support from PEPFAR and CDC through the Georgetown University. PSI is also grateful for the long-standing partnership, Honorable Minister, with the Ministry of Health that we have been part of the journey since 2001. And we are part of the celebration of achieving the 95 targets in Eswatini, which is an indication of the epidemic control for the country. We are local, as PSI, we are locally rooted and globally connected. We have long-term commitment to Imaswati. Siyabonga Kagakulo.
The battle stick was handed over to Georgetown University through the Center for Global Health Practice and Impact. And please help me welcome the new 400-meter runner for this journey, Dr. Samson Aumba.
The Honorable Minister of Health, Senator Lizzie Kosi, the U.S. Ambassador, Your Excellency Ambassador Al Miller, Senior Minister of Health officials present here, the Regional Health Administrator, Chief Jiga, the Mayor and the CEO, my colleagues, country directors, chiefs of parties, program directors for the various PEPFAR and non-PEPFAR implementing partners, the USAID, CDC, and the overall PEPFAR team here, including the acting PEPFAR coordinator, representatives of health facilities, colleagues, ladies and gentlemen. It's an honor today really to host all of you at Chakaza Clinic. We are very privileged that today you've left all your other busy schedules to be with us here. We are very grateful and we cannot take it for granted. It just shows all of you your passion for health services and reaching everyone in this country with the health services. My name is Samson Haumba, Country Resident Director at Georgetown University, but I'm also Assistant Professor of Medicine at the Georgetown Medical School. Georgetown, on this occasion, is formally marking a new transition to the way we do work. It is an exciting journey. We've been mainly providing technical assistance to the Ministry of Health through funding of PEPFAR, through CDC. And so when my brother, Dr. Ndale, was exiting, handed over this baton to us. So we want to appreciate PSI for the foundational work that you started at the former clinics, New Start and Litembali Yetu. We have built on these foundations to ensure that we improve the reach of our clients, both in terms of the services, but also in terms of the scope. This clinic opens 8 to 8, Honorable Minister, and Your Excellency the Ambassador, early opening ensures that people who are going to work can be able to access services early, and also opens quite late. I've been here as part of QA, just as a disguised client, 5 minutes to 8, and I've been able to find people working at this place. Sometimes they don't close until when the last client has left the place. Honorable Minister and Ambassador, we want to appreciate the support both from the government of the Kingdom of Eswatini and from the US government for enabling Georgetown University to have this opportunity to serve this population in Matsapa. Our practice specifically designed to provide this community with patient-centered, continuing, holistic, comprehensive chronic care to all the individuals, not only HIV, but all other health services. We also reach out to the family and the community. Honorable Minister and Ambassador, I want to appreciate and acknowledge the power of partnerships that have made all this work possible. Of course, want to start by appreciating the Ministry of Health and the government for trusting us with the opportunity to manage the Emaswati and to provide first world care to them. I want to thank CDC with funding from PEPFAR and the US government for the crucial guidance and training to the GU staff and the Ministry of Health staff who support this clinic. We also want to thank the government for linking us with the essential components. For instance, we are linked to the central medical stores to provide some of the medications. We are linked to the central, to the client management information system that helps us to integrate all our services with the ministry and the government systems. We want to appreciate the Manzini Regional Administration, especially the Matsapa town, the town mayor and the CEO and all the staff in the town who have enabled us to get the licenses that we need to operate, but also to collaborate with us in ensuring that the site meets the minimum standards, but also help us to access other services that the town council provides. We want to appreciate the RHMT for working with us to set up the systems, and of course the community and the catchment area for welcoming us. But above all, we do not work as an island. We work with other PEPFAR implementing partners and the non-PEPFAR implementing partners who provide various types of support. We also have fruitful linkages and referrals with the other health services in this place. As a clinical implementing partner, the clinic provides GU with immense opportunities, including testing some of the clinical and other service delivery innovations before we can scale them up, showcasing and leveraging new types of service delivery. We've just seen the Lula meds. We know that this is not our invention at this clinic, but it came out the Ministry of Health working together with GU to come up with that technology. But at Chakaza, we can further demonstrate its effectiveness and patient convenience, as you've heard. This place will also assist us to keep our clinical mentors grounded in clinical practice. So it is a center where our mentors can come and have hands-on experience, as well as showcasing integration of clinical services, but also for teaching, for research, as well as service delivery. Finally, in the future, we have some dreams that we would want to realize, and I think as we are going around the clinic, some of them were highlighted. One of them is streamline access of medical supplies and commodities to our clients. So we get a minimum amount of medical supplies from the CMS and the rest we have to access through other means. But then also, as mentioned by our colleague, Dr. Pido, the laboratory tests, the range of laboratory tests done in-house could be broadened if we got additional equipment, like the gene expert, so that we can do some of these tests on site rather than transporting them to other facilities. Ladies and gentlemen, allow me once again to ask you to feel welcome and to know that this service is available even to us. We can always come back another time to access the service beyond just inaugurating. Thank you so much, and thank you for listening to me.
The clipping thing, because they said that I will appear on YouTube just mouthing. And because I laugh a lot, they may think I'm crazy, so I need to have this on me. The next item on the agenda was some interlude from beneficiaries, and I think we had the privilege of one of our beneficiaries actually having an interaction with Honorable Minister and Your Excellency. I will just translate what he said, paraphrasing in Siswati. The beneficiary who was just receiving the parcel from the Lula Meds locker said that there is no longer any need to lose money because he needs to come and pick his medication. In the old times, he would have to miss that day and not count it against the employer. But now he's very happy and he wants to thank you. I think that's what he said in paraphrasing. So I think the convenience is already tangible, and we're expressing that for Chakaza, because of its location, one of the things that we're already starting to pick up is the rate at which clients are actually willing to enroll onto Lula Meds is much faster than what we had observed in other facilities. Currently, of all the 5 facilities where it is, Luyengo is currently the one that has got the highest uptake, with almost 35% of the active cohort of clients receiving their medications through the dispenser. This is a clinic that has got about 3,500 ART clients, and almost 1,000 plus are actually taking their medications there. In a space of a month, Chakaza had already enrolled about 20% of the TX car, what we call TX car, or the active cohort of ART clients. So we are really hopeful that it is a showcase of the impact in terms of client convenience in a setting where most of the people being served are actually economically productive and require the time that they need to actually go and fend for their families rather than actually coming to pick medications when they are not unwell. So this is really going to have a long-term impact on client-centric service delivery in the era of last mile HIV epidemic control. I will invite Mr. Mpanza, I don't know if he's in the house, the regional secretary, to introduce the RA for his remarks. Islamini. Oh, Islamini.
Honorable Minister, we happen to share the same name with the program director. He's also in Arnold, but he has mistakenly called me Mpanza Yetami Dlamini. Honorable Minister, Excellency, the Ambassador of the United States of America, RA, the 2 mayors present here, the directors from the respective sectors, a very good afternoon to everyone. I have a simple task to request the RA to ascend the stage. The RA assumed office in 2018. He is an engineer by profession. He has engineered a number of systems in the country. One is the current service we are receiving through Water Services and Corporation, where he has worked. He has also engineered or he has assisted the country in conducting better elections, moving from manual to digital. As an engineer, he's assisted the country to do that. Currently, we're one of the best nations that conducts elections professionally, and it will be witnessed in the forthcoming elections, all started by none other than the regional administrator, Umbane Ngosi, Chief Gicha. One is winking to me. Is he married? Yes. It is compulsory for him to be married because he is a chief. Please, Umbane Ngosi.
Honorable Minister, our health listener Lapa, Your Excellency Ambassador of the USA, PS Health, I didn't see him, but they said he's here. PS Health is here, Zone. Or it's being represented, yes. And I heard there are numerous doctors, number of doctors who are here, and staff, Saga, PEPFAR, and all the medical practitioners we have. Mine is a person representing Manzini region. I haven't prepared a speech, but I'm here to welcome this magical, beautiful clinic on behalf of the Manzini people and to appreciate what I've just heard. They offer friendly services, which I think that comes very nice to people like myself, men who don't go to clinics. They offer friendly services, so it's not my first time and my last time. I'll be coming here now and again to get some services. One thing that took my, which I appreciated a lot, was to see the automated issuing of medical drugs, which actually cuts down the time for waiting. I know I've been a patient before. I know patients are not patient with time. So now, in that informative paper, they said now, I think maximum time you can wait here is about what, 30 minutes or so, which I think it works well. We'll actually push people to come and visit this clinic. Our job is what we'll be doing, is to push people to come and visit the clinic. And I don't know if it's true that it's free health services. Yes. Oh, it is, yes. Minister, I don't know if we can make up money that we can multiply this clinic, that we have it in all the regions, so that it can service a lot of Swazi people who are appreciating it anyway. Thanks so much. I don't have a speech. Before I break it.
Siyabonga Mntwana Nkosi, siyabonga Mlangeni. I think those are words from one of our elders, senior citizens, and someone who has been in the trenches, as has been highlighted in terms of bringing the country to where it is. I will now ask Ms. Kontile Kunene, the acting PEPFAR country coordinator, to introduce the US ambassador for his remarks.
Thank you, Program Director. Please allow me to confirm that I observe all protocols that have been covered by previous colleagues. So I'll just say good afternoon all. I am here honored to be introducing Ambassador Earl Miller. Ambassador Miller is a very well accomplished United States senior foreign service official. He has worked around the globe in many countries, and just more recently, he has been in the region since around 2011 when he was the US Consul General in Johannesburg. So from 2011 to 2014, he was in Johannesburg, and then he moved over to Botswana from 2014 to 2018, where he served as the United States ambassador in Botswana. He also, during his time in Botswana, he was also the US representative to SADC as the US representative. After Botswana, he was in Bangladesh, yes, from 2018 to 2022. And then we have the privilege of having him in Eswatini since January 2023, although it probably feels like much longer, because he is very supportive. He is very involved in everything we do. He brings with him a wealth of experience, and we are privileged to be under his guidance and direction as the U.S. Embassy, within which PEPFAR sits. Ambassador Miller? You're welcome.
Well, you can see I'm blessed with a wonderful staff. You know, yesterday was July 4th, Independence Day in the U.S. Are there red, white, and blue balloons for me? Is that? I appreciate it. I have wonderful remarks prepared by my staff, but I think most of what I wanted to say has already been said. I'm among heroes here. People that work in the public health sector are society's true heroes. And just the opportunity, the privilege to talk to the people in that clinic who are saving lives every day, to have a chance to work with the leadership before me every day. 35 years in the U.S. Foreign Service, this is what gives me the most satisfaction. It is an honor to be a privileged guest in your country, and it is an honor to be here with you today as we open the clinic. I was in Botswana in the mid-90s and returned as the ambassador 20 years later, and I saw what was happening to that country with HIV/AIDS, and knew what was happening in this country as well. The two countries the hardest hit, right? And look how far we've come. People say it's a miracle. It's not a miracle. A miracle comes from heaven, comes from God. What happened came from you all. You did this work. You saved those lives. And you have my eternal admiration and gratitude. And it's a privilege to be here with you. And I love where this clinic is. This is the first clinic I've visited in an urban area. It's so convenient. You see the foot traffic and people coming and the convenience. I think it's wonderful. And the gentleman who said, I don't need to take a day off from work to come and see a doctor. And you're right. Us men, we don't go to doctors, right? They ask someone once, a man, what's the leading cause of death in older men? They said embarrassment. We never go to the hospital, right? And we don't. But something like this makes it very, very easy for us. So well done. Congratulations. Honored to be here. Thank you.
Those were few but very, very pregnant remarks. Pregnant in wisdom and filled with a lot of admiration, I think. There's an opportunity for self-applause as you go back to your homes in recognition of each and every one of our individual contributions to where the country has come thus far. Ladies and gentlemen, please allow me to welcome Magesindi Matse, who is standing in for Dr. Zwane, the PS of the Minister of Health, to introduce Senator Lizzie to give her remarks. Magesindi.
Program Director, Honorable Minister, Ambassador L, Regional Administrator, Chief Gija, the mayors that are here, PEPFAR team, implementing partners, country directors, and also all colleagues that are here. Good afternoon. I am Cindy Mate. I'm the Acting Program Manager for Eswatini National AIDS Program. It is my honor to be part of this great day where we are commissioning the Chakaza Emphilweni clinic and also the launching of the Lula meds. For me, it is also an honor to be standing in for the peers who couldn't be here today because of other commitments. So with that, since I'm here, I would also like to express my appreciation to the Georgetown University for their contribution in the health sector HIV response by expanding the differentiated service delivery models, which we know it is a strategy that is meant to address the challenges that our clients are currently facing in closing the gaps of access to our health services because of the operation hours that are implemented in the country. So we appreciate such initiative that is going to close the gap as we are controlling the epidemic. We also appreciate as a program the integration of services. As they were presenting here and also as we are going around, they did share the package of services that is being implemented. It is something that we are appreciating as a program to see that whatever that we plan at program level, it's what is implemented at ground level. So we appreciate what we've had here, what we have seen here, and we really appreciate that. It will go a long way in providing the services to Emaswati. At this juncture, may I take this opportunity to humbly invite our Honorable Minister to take the podium. Thank you.
I need to step up here. I'm not tall enough. Thank you. Thank you, Program Director. It's a great afternoon for all of us. I like to say that when you have one. I really like to say that. Your Excellency, Ambassador Miller, Your Lordship, Mayor, Councillor Russo, hey, so many people to greet here. I would like to recognize all the leaders of the partner organizations that the Ministry of Health works with here. I see so many familiar and very treasured faces around here representing a very strong partnership. Dr. Haumba, when he came up here, he talked about the benefit and the value of a strong partnership. So it is a really wonderful day for me to be here this afternoon for the commissioning of this Chakaza Emphilweni clinic. Ambassador Miller, I could see the difficulty you had, but you had the sense to just abandon the pieces of paper that you have, because I have the same problem as you. I would have to repeat everything everybody had said, and yet there are critical things that I really would like to remark on. We appreciate you. We appreciate your passion about the health of this nation, the health of this region. And I'm very pleased that it's coming to your region, because I know you are one of the best advocates we have in health in terms of ensuring that services are going through here. Having said that, it is such an important thing that happened here today for PSI to be handing over to GU. Piece of work that they started and continuing. You know, we sit here and we see bits and pieces, and we're trying to make sure that the linkages are smooth. But the people who are serving have one life, and it's a continuous life. And that is why it's so important that we do things and we can transition very smoothly. I have learned a few things today here. We are battling as a ministry to just make sure that we are taking the ministry into the 21st century, fully digitize health services and to come here and hear how you are using the client management information system, because we're looking at the potential of it all and what else it can do. And for me, it was the first time I heard that actually the system has a potential to notify. You know, we have a lot of tools that are notifying us, but to have a client management system that will remind people to come pick up their drugs, to come for their, I did not know this. I would have advocated more. Now I have more tools to advocate for the system and to look at where else it can go. We are battling just now to make sure that our client management client information system is actually linking properly with our supply chain system for medicines. And that is another piece, Your Excellency, both supported by the US government through PEPFAR to USAID, that we're looking to link. It's now linked, and we need to roll it out. And I am excited for the next few years, the next few months, as we see this roll out and we can get a properly digitized system. I'm not talking just about digitalization, really. I just want to talk about how well our HIV response has been driven by data. This is one service where we were very clear from the beginning when we started this, this work way back. I wasn't here, but it is data driven. We have analyzed this data, we collect it every day, we're using it to plan, we're using it to inform what we need to do. And when we're talking about digitalization and talking about one system, I was very happy to hear that. Talking about one system so we can all benefit from this, we can all track what we're doing. We didn't, like you said, Ambassador, we didn't get to 95, 95, 95 by miracle. We got here because these wonderful people sitting here and all those wonderful health workers out there were literally intentionally picking up that data, analyzing that data, bringing it back to say to the health system, this is where we want to go. This is how we should be doing this. The challenge we have with Ambassador Kengasong having challenged all of us to say, let us reinvent the services we are providing for HIV and AIDS, for TB. Let us reimagine where we can get where we want to go. And I'm looking at these leaders in this room to say, we have a challenge. You know, SHIMS 3, much as it was telling us all the wonderful news, where we've been, where we've come from, I was actually amazed just looking at SHIMS 2 and the changes that have happened between SHIMS 2 and SHIMS 3. But now we are on the last mile. We want to eliminate HIV/AIDS once and for all. We want to be there by the time people are talking 2030, 95, 95, 95, we want to have said goodbye to HIV and AIDS. But I'm looking at all of you as leaders here to say, you know, it's a challenge. We have found out that so many more teenage girls, adolescent girls and young women get new infections over the young men. I was very intentionally looking at the statistics as we were walking around and realizing that in this clinic, that's very interesting, in this clinic there are more men taking PrEP as a prophylaxis to HIV. I remember talking one time when we were having meetings with His Majesty, and he was saying, you mean there is something you can take to prevent HIV? And then he says, why do we still have HIV? Really, I'm throwing it back at you as leaders. They're taking the work forward. Why do we still have HIV? It is here quite evident that we can reach men, and more men are actually taking up the service, much as we thought that men are afraid to test. And I like the innovation in testing. Let's keep working on that. But we can see that men will take up PrEP. We can see that more men will take up PrEP. I was looking also at the age range. I was very surprised to see the 15 to 19-year-old. And in that age group, there were more young women taking up PrEP. Did you notice that? Anyway, we are going somewhere. And without fully digitizing and making sure that we can use these innovations, you know, we know that innovation is what has got us here, but innovation is going to take us through to full elimination into the future. And also the innovation of ensuring that people can come and the automated dispensing. How fantastic is that? you know, if you want to go and get your medicine, you can go anytime at your convenience where you can get it. So, Ambassador, talking with you again, I have a tendency to let my tongue run ahead of me, but we really, really need more of these. We need them everywhere, definitely in all the urban areas, the urban centers. It's not enough in Matsapa to have just one, because we have thousands of young women and young men and men and women who are working here. But across Manzini, across all the urban centers, it would make a big difference in terms of ensuring that people can stay on treatment and can get that service much easier. So innovation and taking this country fully and running with it into the 21st century. So, with ignoring all my remarks, I apologize to the people who contributed to these remarks. I really, it is my singular pleasure, really, and pride in the work that health does, in the work that health workers do, in the work that we do in partnership with the American Embassy, with all the agencies that are here to work with us, that I can officially commission Chakaza Emphilweni Clinic today. And I am absolutely certain that the people using this service here will flourish in their own lives. So, Chakaza Emphilweni. But to officially launch for Matsapa, Your Lordship, do you say Lordship even if it's a lady? Your Ladyship, for Matsapa to officially launch the first automated medication dispensing system. Again, it is a real joy, and I'm really privileged to be standing here doing this. Again, thank you all very much. Thank you. Oh.
Thank you, Honorable Minister. Just two more things that I'll ask my boss to do for us. Firstly, I would ask him to come and introduce a very special member of the front bench, former Secretary to Cabinet, Babembuso, just for some wise words from his very wise mouth. Dr. Aumba.
Thank you, our Program Director. In our midst, we have somebody who has been a very close ally of PEPFAR, but in government. Allow me to introduce Babe Mbuso Dlamini, who was the Secretary to Cabinet before the new team came in. Mbuso works with Georgetown University as a special advisor on sustainability. Invite Mr. Dlamini to just greet.
Sorry.
Honorable Minister for Health, Ambassador Wagitz America, I told you I'm from Oklahoma. That's my home state. So, Ambassador, it's a pleasure to meet you. I'm tempted, Minister, to do some teaching, because this is an official ambush. I'm not in the program, right? So I can say whatever I want. Umntwana Nkosi, lokuba umntwana Nkosi is a position in itself, and it's higher than being chief. So it's not proper to say umntwana Nkosi Chief Gija. Wazi wathi umntwana Nkosi nje it's enough, sakuphelele nje khona lethu. But Mage Ojo, from my other country, Ambassador. I studied in the States and then in Kenya. So this is my second home. This is my big sister. I want to acknowledge you as well. I don't know where this idea of me coming up here came from. But, Honorable Minister, let me start with you. Your term in office is almost over. But the amount of work that you've done, no, seriously, Minister, I know you from far, while being minister, but the amount of work that you put into health, in spite of all the efforts that are pouring in daily on you, people say you're a strong woman, and I fully agree. You are a very strong minister. Whatever happens in the next government, I don't care. You have run your mile, you have all of these things to show. Yeah, best now, and just the other week at Estrogot, at the Look Commission, with His Majesty on the sword, you took him around. And it's just amazing the amount of information that has happened. I can't even remember who the previous Minister for Health was really. I really don't remember. But the point is, my history, meaning our electronic government. So when I see a minister actually rolling out electronic government the way you have done, it's amazing to me. For you to appreciate the client management information system, what it can do. Up to today, you're still finding out. To me, it shows how much you moved this whole thing forward. Mr. Minister, I don't know what these people are trying to do, but manager, I'm saying, Siyabonga Minister. I mean, I work at health. From far, I've been in health, HIV. And I remember Minister Begna Mazia. Yeah, during that time, I used to attend all these meetings about AIDS. There are two graphs that he kept showing us. The Bafago, the prevalence. I don't know what the graphs were. But I said to him, look, I'm not going to come to these meetings anymore. Because by 2020, we'll all be dead. There'll be nobody in Swaziland. Okay? Yeah, I just said, I'm not going to take it anymore. I'm not disputing the statistics, but it's too frightening for me. So I refused to go to his meetings. Okay. But when it was really hard, Your Excellency, like you say, you saw, the biggest impact for me, HIV/AIDS minister, I went to a memorial service, Le Mbaban, a cathedral. Somebody had died and I was going there. When I reached the door, they were asking me whether ngitelwe kama vimbela noma kama vuso. I said, why? And I just walked in and sat down. I didn't understand why this guy was asking me. And when I sat there, I realized there were two coffins there at the front. One wakama vuso, the other one wakama vimbela. So there was no way the church couldn't deal with the number of requests. So they had to deal with Bagamavuso first, because by Nhlangano. So that service went through and we released them. Then we'll deal with people Bagamavimbela. So it really struck me. I said, yo, this thing is really bad now, okay? Yeah, so we've come a long way, okay? I didn't know what 1990 was until my son told me what it was. So for us, we had 95, way before 2030. I don't know how much credit you need to get for that, but you got it. You have to take it and run with it. So for the implementing partners, Siyabonga. The relay that you're talking about, nice smooth relay, right? You've seen relays where you hand over and the platoon falls down. Yeah, this one didn't fall down. He handed over to him, and here we are. The race is going on. So it's your partners, Georgetown, all of you. Like the ambassador said, it's not miracle, it's people working. It's just that other people don't realize. You have to be inside health to understand how difficult this issue is. But Minister, as we say, you've been strong. Please take your credit and run with it. So, are you happy now? Yes. Can I say? Now, I get very emotional, Uncle my HIV/AIDS, because there are so many things that I went through. I'll give you one, what really is still alive with me. There's a couple that we knew, family friend. So the mother got sick, and we used to go there with my wife to check on her. Until it got to me, I said, look, I can't go anymore. The condition that she's in is just too depressing for me. I'm very weak emotionally. So my wife used to go. And then she was taken ill to Mbabane Clinic. So when she was taken into Mbabane Clinic, we informed my in-laws in Hlangano to say, hey, I said, how is that so? Is it that serious? He said, yes, it is. Please go. Minister, you won't believe what happened. These people had known each other for 50 years. So they asked what number it was, and we told them. So when they got there, they opened the door. And the person they saw there was not the person they had come to see. So they said, oh, so when they were closing the door, that person said, please, what? The person is not the person they're looking for, but the voice is the person. They just stood there. They just didn't know what to do. Fortunately for them, the children were just coming in at the time. They said, oh, man, HIV. 1 year after she died, the husband died as well. And later on, I discovered they died of HIV/AIDS. So that's where we're coming from, Minister. Siabong.
Thank you, Babe Mbuso. Babe Mbuso usually invites everyone for a cup of tea in his office just next to ours. So I think there are many stories he can tell you that will build you and grow you, and there's a lot of wisdom. He's a fountain of wisdom, and you can siphon from him at any time. Just one last bit. I'll again ask my boss today, I'm his boss, to come and introduce another special guest who thank all of you for us, Dr. Samson Aumba, to introduce Dr. Ojo.
Thank you. In the interest of time, allow me just request Professor Ojo to come to the podium to give a vote of thanks. Professor Ojo is a faculty coordinator, is also a co-PI for our projects in Eswatini. She's based in Kenya, but she's a common face around. She provides the technical support from time to time. So it's a privilege that you're here during this event. So please help us move a vote of thanks to the guests.
Thank you very much, Program Director. Thank you, Dr. Aumba, for the kind introduction. The Honorable Minister, I'm officially a fan, Senator Liz Nkosi, the U.S. Ambassador to Eswatini, Your Excellency Earl Miller, the Ministry of Health, the senior Ministry of Health officials that are here today, Manzini Regional Administrator. In Kenya, our constitution allows more than one wife. Your Worship, the Mayor, distinguished guests, colleagues, ladies and gentlemen, good afternoon. It is truly my privilege to be in a position to really be part of this occasion. and to be the one to give the vote of thanks. I think, having worked in Africa, in many countries, I really appreciate the kind of commitment that I've seen from the highest level in this country. And it is really a privilege that this, certainly my colleagues at Georgetown here, but really the overall fraternity, that you were able to grace this occasion. And that really goes to both of you and your high-level teams here today. And I think that is just an admirable and very major thing. So mine is really very simple. This kind of opportunity that we've had today, the official commissioning of the clinic and also the official opening, launching of the Lula meds, those things would not be possible without the kind of collaborative partnership and effort that we see represented here today. So Honorable Minister and the Ministry of Health officials here, we are grateful that you're able to grace this occasion, but really that your leadership and guidance makes this kind of thing possible. And this is the sort of thing that we need to be able to provide inclusive services, as we've all heard today, and services that meet the needs of the 21st century client that we currently serve. Your Excellency, Ambassador, we are very cognizant that the PEPFAR, and in particular in this case CDC, the resources that we get from the US government and the US taxpayer really does make it possible, both for the technical support but also the financial resources for this kind of thing to be possible. And we are grateful. But primarily today it's really because you are able to come in here with your team and spend time with us and help us launch these two services. Our thanks go to the regional administrator, to the regional health management team, and to the Matsapa, town mayor. These are the officers that make it possible for us to implement. Without the partnership at this level, it's virtually impossible to have this kind of service, particularly as this is outside the normal services that we work with within the Ministry of Health. So to get this going required that kind of collaborative approach, and we're really grateful that we're able to get that. But today, particularly for your presence on this occasion. Our implementing partner colleagues, as somebody who works for Georgetown University as an implementing partner, your presence here for me is both humbling, but a reminder that we actually serve the population we serve. So, and that is why we are here, and it is at the, because the Ministry of Health allows us and supports us to be here. But thank you so much for being here today, and for us to be able to see that through the leadership of the Ministry of Health and CDC, we are all able to build upon the foundations that have been developed. And certainly not last and definitely not least, really the clients that we serve are the ones that make this kind of occasion a special occasion for all of us, because without them, there'd be no reason for us to be talking about all this today. So really, we are very grateful as Georgetown University that you were able to spend time with us this afternoon and to officially launch these two services. Thank you very much. Siyabonga.
Your Worship, the RA, distinguished guests, it's been my singular privilege to direct today's proceedings. I hope I did not break English. It is not my native language. So if I used a word that was not supposed to be used, please just delete it from your mind. You've been a wonderful bunch in terms of directing. We are exactly on time, actually 3 minutes ahead of time. So I think our time management just shows the level of leadership and commitment to cause that all of you enshrine within your daily conduct. I don't think I can say anything. I can't say officially over, but I think I deserve a round of applause. Thank you very much. I will invite all of us for a photo shoot and then for some takeaway, dinner, lunch as we depart. Thank you very much. So we start with? Oh, sorry. There is the symbolic launch for the Honorable Minister and Your Excellency. Yes. For a photo shoot. Indali.